Respected scholars, elders, brothers and sisters, Assalamu alaikum wa rahmatullahi wa barakatuh. Ramadan Mubarak to you all. Alhamdulillah, we are truly lucky to have been blessed with another opportunity to derive the benefits of this holy month. After all, it is a month of change, of positive reform, and of becoming better human beings. As well as achieving this at a spiritual level, it's also important that we should use this opportunity to achieve physical reform as well, and make a commitment to leading healthier lives, inshallah. The ultimate aim, of course, being to better serve Allah subhanahu wa ta'ala. This year, the Al-Mahdi Youth Committee, in conjunction with the Muslim Student Council, is proud to present the Ramadhan Health Awareness Campaign. In Wessex, this will be consisting of tonight's talk on healthy living. There will also be a talk next week, inshallah, on mental health and looking at issues such as depression. And we will also be having a health screening day just after Shahr Ramadan, inshallah, where you can come get your blood pressure checked, your blood sugar levels, and essentially have something, what you might call, for example, a health MOT done. So today, I'm going to be, in the 15 minutes that I've been allocated, I will be speaking about two of the main threats that face our health as a community. And then I'll be giving you 5 of my practical tips as to how to avoid these, how to overcome these threats to our health. So I've chosen just the key information to share with you today. If I did want to confuse you, I would have chosen to speak about anti-disestablishmentarianism or pseudo-hypoparathyroidism, which is incidentally a thing. But today I hope that we can just come out from this talk with a bit of a better understanding about how we can take some practical steps to living some better lives, inshallah. Having said that, if you do have any questions after today's talks, we will be having a health information stall in the gents entrance and in the ladies entrances. And so do come along and say hi, and we are there to answer any questions that you may have. So as we are taught through proverb, it is always important to know your enemy. Today I'm going to introduce 2 such enemies that particularly affect us as a community. The first of these is diabetes. There are 2 types of diabetes, but I'm going to be particularly focusing on the more common type, which is type 2 diabetes. The second enemy which I'll be speaking about is something known as coronary heart disease. So first off, diabetes. So diabetes is, the understanding of diabetes focuses around 2 main things: blood sugar levels and insulin. Sugar is something that our body needs to survive. Our cells need it to make the energy that is necessary for pretty much every bodily function. And insulin is the hormone that our body produces to make sure that our blood sugar levels stay under control. So let's have a look at what happens in a healthy individual. So after a meal, your blood sugar levels go up. Your body notices, or your body senses, the increase in blood sugar levels, and as a result, it produces more insulin. What does this insulin do? It helps the body to actually use the sugar, and as a result, the sugar levels return back to normal, which is great. So what happens in diabetes? So one of 2 things can happen. Either the body is not producing enough insulin, or the insulin that is being produced isn't necessarily effective. So the net result of this is that the blood sugar levels can become persistently high. You may ask, is that such a bad thing? Sugar is, after all, so essential to the way our body works. And in fact, most of the time, it doesn't feel any different when you have high blood sugar levels. But let's take a look at some of the things that can happen if your blood sugar levels stay high for too long. So these are known as the complications of diabetes. These include an increased risk of heart attacks and strokes, up to 5 times the risk. It can also cause nerve damage, which in itself then leads to a whole host of other different problems. It can also damage your kidneys and indeed lead to kidney failure. It affects your circulation, and as a result, many patients with diabetes find that they have some problems with their feet, including things like foot ulcers. It also damages the back of the eye, and as a result can significantly impair your vision. And it can also increase the risk of complications in pregnancy. So all of these, each and every one of these, has the potential of being life-changing. But something that's important to note, that if you do have diabetes, There are things that can be done to control your blood sugar levels, including medication and appropriate lifestyle interventions. And if you are able to do that, then there's no reason whatsoever that any of these complications should occur. So, unfortunately, diabetes is something that us Khojas in particular need to be wary of, as several studies have found that Asians are one of the biggest risk groups for diabetes. And if you're wondering about the risk for the Iranians and the Arabs here today, I'm sorry to say that unfortunately you're quite similar to the Khojas in this regard. So we've looked at one enemy. Let's have a look at the second, coronary heart disease. So as you all know, the heart is a muscle shaped about the size of your fist, and it is the most active muscle in the body, constantly working to ensure that the rest of the body has the blood that it needs. As such, it requires a large amount of oxygen and nutrients to meet this large energy demand. The innermost layer of the heart can get this from the blood inside the heart, but actually the majority of heart muscle depends on the blood supplied by the arteries in this diagram, known as the coronary arteries. Over time, these arteries can become clogged with fatty plaques, which means that less blood can actually get through to supply the heart. So just remember, whenever you're enjoying your samosas, your bhajiyas, your halwiyat, that maybe it might be prudent to show a bit of restraint, and if you do, then I'm sure your coronary arteries will thank you in the long term. And baklava, unfortunately. So, if these plaques become big enough, they can actually stop the blood flow to the heart, and this is something that we know, that we refer to as a heart attack. If the plaques are if the blockage is partial, then this can lead to something called angina, which is basically intermittent chest pain that comes and goes. But this, left untreated, can also lead to heart attacks in the long term. And this can also lead to heart failure. And in heart failure, the heart isn't able to effectively pump blood around the body to meet the demands of the body. And as a result, it can lead to problems such as tiredness, ankle swelling, breathlessness, particularly on lying down. So if you have noticed any of these things, then it's important to go and see the doctor about it. Coronary heart disease is the biggest cause of death in the UK and worldwide, so it's certainly not something that we can afford to be complacent about. So let's have a look now at some of the culprits that actually promote clogging in our arteries. So a lot of what is contained in the fatty plaques is actually cholesterol. That's how your samosas, your pakoras, your baklawas, and your pizzas and chips and stuff, that's how they do the damage, through increasing your levels of cholesterol. The second one is a big one, smoking. Along with polluting your lungs with literally thousands of chemicals, smoking also promotes clogging in the arteries and therefore does increase your risk of heart attacks. Thirdly, high blood pressure. Sometimes there's no specific cause for high blood pressure, but some things that can increase your blood pressure are salt, stress, being overweight, smoking, and a lack of exercise. And fourthly, diabetes, which we've discussed previously. So all of these things individually increase the chances of your arteries becoming clogged, and the risk is even greater if more than one of these things apply. So now time for my top tips on how we can avoid some of these threats to our health. If I were to tell you there is a treatment in fact, it is free, it is easy to take, it has some immediate effects, and it has some long-term effects, and you don't even need to see your GP for it. Does anyone know what I'm talking about? Exercise. In fact, yes, exercise is a miracle treatment. If it were a pill, it would be considered one of the most effective drug treatments ever invented. And what's the dose? 30 minutes of moderate to vigorous intensity exercise at a frequency of 3 times per week. What do I mean by moderate to vigorous intensity? So essentially I mean anything that is going to raise your heart rate to a significantly higher level. So for some of us that might be something like a game of tennis or a session on the treadmill. For others that might be a brisk walk. Or for some of the elders in our community it just means walking as much as is possible. And for all of the social media users today, when I say exercise, what I don't mean is donning your exercise gear, going outside, getting the iPhone out, quick selfie, put it on Facebook, #selfie, exercise done. That's not what I mean, unfortunately. I mean a serious exercise where you're getting your heart rate pumping. If you are able to do that, then exercise does have numerous benefits, and some of these benefits include a reduced risk of major illnesses such as heart disease, stroke, diabetes, and cancer, reducing the risk by up to 50%. Also lowers your risk of an early death by up to 30%. It also has psychological effects, can boost your self-esteem, boost your sleep quality, and also reduce the risk of other conditions such as stress, depression, and dementia. So that's tip 1. Tip number 2, eat less, live longer. I want to talk to you briefly about one of the islands in Japan. It's called Okinawa. This island has 2 to 40 times the number of centenarians when compared to any other island. 2 to 40 times the number of people that reach the age of 100. So Okinawa is known as one of the longest living populations on the planet. The death rates from stroke, cancer, and heart disease are significantly less than the national averages. And here's something interesting about these people. The total energy intake is actually 20% less than the national average. So they're eating less and they're living longer. Just some food for thought. So you may say that that is just a coincidence. Well, in fact, this method, known as calorie restriction, is the only tried and tested method, according to scientific data, of actually prolonging your life expectancy. And this has been shown in many different animals, such as rats, spiders, and guppies. And if you have a look at the chart on the left, for example, that shows a study that shows that if the more a mouse eats, it actually causes both the average life expectancy and the maximum life expectancy to decrease. This is data that's come out maybe within the last century or so, but it only confirms what Allah subhanahu wa ta'ala has been telling us all along in the Quran, where He says, Bismillah ar-Rahman ar-Rahim, eat and drink, yet not in excess, for Allah loves not those who commit excess. Tip number 3, weight loss. So I mentioned earlier that Asians are at a particularly high risk of diabetes. Unfortunately, that's not the end of the story, but also the higher your weight, it actually increases the risk of diabetes more in Asians than in other ethnic groups. So weight loss itself has countless benefits. The ideal body mass index is between 18 and 25. And if you're not sure what your body mass index is, then do come along to our health screening event just after Ramadan and we'll be able to measure that for you. But not only is it your weight that matters, but also your waist circumference. And this has been particularly shown to have an effect on your risk of diabetes. So for females, the waist circumference should be less than 80 centimeters or 32 inches. And for gents, 94 centimeters or 37 inches. And if it is greater than this, then this is leading to an increased risk of diabetes. And for those who think that weight loss can be a mammoth task, it is easier than, or more manageable than you think, and can be achieved by a combination of reducing portion size, eating the right kind of foods, lots of fruit and veg, and regular exercise. And you can visit the NHS Choices website for more information, and actually you can download a 12-week program to help you do this. Fourth one, stop smoking. And could I just say that for those people who are smoking, this is the one biggest thing that you can do to actually improve your health outcomes. And I can't stress that enough. And if we have a look at some of the things that are inside a cigarette, then that should tell us enough. That should be enough to tell us that this isn't something that we should be putting into our bodies. And of course, smoking can lead to a whole range of different health conditions. So just to emphasize, there's nothing better that you can do than stop smoking if you are a smoker. Finally, my last tip, cut down on your 3 S's: salt, sugar, and saturated fat. Salt is one of the things that increases your blood pressure. Sugar increases your risk of diabetes. And saturated fats increase your risk of coronary heart disease. So by trying to eliminate all of these or trying to reduce these from your diet, then you can actually have a massively positive effect on your health. So that's the 5 tips for today. The summary is on the slide. I'd like to leave you with a choice. After all, in Ramadan we have a choice as to how we act, and we also have a choice as to how we act with regard to our health. Either we can take the path that includes an unhealthy diet, putting on weight, smoking, and that leads to diabetes, heart disease, and heart attacks. Or we can take the path with a healthy diet, regular exercise, which leads to improved fitness and better health outcomes. A final parting thought from the Holy Quran: and make not your own hands contribute to your own destruction, for Allah loves those who do good. Thank you very much for your time. Assalamu alaikum wa rahmatullahi wa barakatuh.